50% of people in the US delay care until it's typically pretty late because they're just too confused and they don't know when they should go, why they should go, and where they should go.
Got it.
And so we can help direct those folks into care early.
Okay. Welcome back to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm your host, Logan Plaster, with my guest today, Chris Turner, CEO and co-founder at HealthBook Plus. On the vest, I love it.
It's on
How
there.
you doing today, Chris?
I'm doing excellent, Logan.
Awesome.
Yeah.
So it hasn't been that long since our last conversation, and yet in startup land, 4 months is probably like 4 years.
Exactly.
Right? So tell me where you're at currently with HealthBook Plus. What have you built?
Yeah, so it's really amazing. What we built is this platform that helps people own their health by leveraging data and AI. And if you remember from our last conversation, it's our first step into building a fully automated, AI-driven clinician that will ultimately have prescriptive authority for low-level conditions.
Okay. When you say prescriptive, okay, so we're working towards a place where I am conversing with a conversational AI platform that is actually giving me medical advice.
You got it.
Okay. So one thing I find interesting about HealthBook Plus is that you're pulling in a variety of data sources. Talk to me about the unique blend of data that you're using.
No, it's pretty impressive and very complex, but we bring in electronic health record data from multiple sources. We connect directly to some electronic health records, others we connect to the health information exchanges to grab that data. We collect payer information, so claims data.
Okay.
And if you have a wearable or smart device, we bring that sleep, biometric, and exercise data into our platform. We also purchase socioeconomic data. And then, of course, categorize all of that information so you can share it with your clinician, with your family members. We also have a component coming out in 2 weeks called our Care Club Plus, which will give you the ability to take care of an ailing parent if they give you a consent, or if other family member, as well as your children, all in one platform.
Okay. Now, I understand pulling in your EHR data. I understand the claims data. What does it mean to purchase socioeconomic data?
Yeah, so a lot of people, either they have never been to a health system or they don't remember their login. So we're able to build models off of very unique data, like financial data, for instance.
Okay.
How you spend your money, whether you buy new cars versus used cars, do you shop at Walmart versus Target. All of those different disparities we could build models on that are predictive to health.
Okay. How is that going to help okay, so it's like you've got this group of the population that really is not interacting enough with the health system. And so this data starts to get you in the door of understanding who they are and what they need.
That's right. It's a pretty astounding statistic, but 50% of people in the US delay care until it's typically pretty late in their disease state because they're just too confused and they don't know when they should go, why they should go, and where they should go.
Got it.
And so we can help direct those folks into care early.
Okay. So who do you work with? Hospitals, employers, ACOs?
Yes.
Yes.
But we're really more focused, 2024, we're focused on direct primary care clinicians
Okay.
and their patients as well as payers.
Okay.
Those are our two markets we're
Okay,
really
talk to
targeting.
us about direct primary care. I find that to be a very interesting market. Not everyone knows, maybe they even go to one, but they don't know it's a DPC.
Yeah.
Talk to us about that market.
Yeah, so I always put in there direct pay primary care
Okay.
because a lot of people don't know what is a DPC doctor.
Yeah.
And they're a doctor that basically gets a fee for service paid by cash. They don't collect insurance.
Okay.
And so what we found is their patients are typically very health-focused individuals. And the clinicians themselves oftentimes work by themselves. And so if they get a new patient, it's really difficult to gather all of the health information for that patient. And since they're more hands-on doctors, they want to be able to take advantage of wearables and other devices, but they don't have the time to monitor every day.
Sure.
So by getting alerts from HealthBook Plus, it's a really big win for them.
Okay. So let's talk about the alerts. What does it look like? I'm one of your patients. I'm using HealthBook Plus. I go to a direct primary care provider. I have a wearable. What kind of alerts am I getting? How is it changing my behavior?
Yeah, great question. So multiple different types of alerts. So we've got different AI models that sit on top of all of our data to give mostly preventative alerts. But we also have the ability, if someone's having an acute issue right now, they can walk through our instant health check, and that'll tell them a short list of possible conditions for what they're experiencing with their symptoms,
Okay.
and then where they should go get help. And all of that, the alert, whether it's a preventative alert or whether it's an alert that comes from the instant health check, goes to the clinician. So a clinician can stay on top of their patient's health care without having to get the phone call at 2 a.m. or to be sending messages back and forth to understand what's going on.
Interesting. Let's talk about you as a founder and the startup itself. How long have you been in business?
October of 21 is when we started this journey.
Okay, so you jumped in 21, a couple years, and before that, where were you?
Before that, I was at a company called Medici, where we built the WhatsApp for healthcare.
Okay.
At the end of 2018, and then this little thing called COVID happened, and so we basically went from no revenue to 5 million in 18 months.
Wow. Okay.
Really big.
Okay, so you're at Medici.
Yeah.
You decided to jump off and to do your own thing, take a risk. And I guess my question is, has that met your expectations? What kind of surprises did you meet along the way over the last couple of years?
Wow, big question. So I would say, no, I did not forecast everything right. I've had giant ups and downs that have been pretty compelling, but super fun. So, But what I will have to say, though, is we'll back up a little bit. At Medici is really where I got this concept, and like, I have to do this, and then ended up meeting my co-founders in Greece, and we stacked hands and put it together. But it was really interesting because we had this big growth at Medici, and then Twilio came out with a platform that basically, if you had a healthcare audience for 20 grand and 2 developers, you can have telemedicine. And we knew, like, ooh, like, this is going to be game changing for us, and the bottom's going to fall out, so we have to pivot.
Okay.
So I was running all of our commercial business there, and so our CEO came to all the executive team, and we had to come up with an idea that could help millions of people and make money doing it. And HealthBook Plus was my idea then.
Interesting.
And so it kind of stemmed out of that whole thing, so it was really cool.
Do you feel like that moment of learning how to pivot at that high level, high executive level, has informed kind of your ability now to be flexible?
Oh, without a doubt. I mean, I don't know if I told you, but we had a challenge with our CTO that we brought on early on as a co-founder, and he ended up being a bad actor, and we had to terminate him. And with that, we found a bunch of bad code, and just the platform wasn't built as we were hoping, and so we had to totally recover from that. And we got an amazing team now, and they're fixing all the problems, but also rebuilding as we go. And so, those ups and downs are crazy.
What are you looking forward to about 24?
Just adding a lot of people on the platform. So we're at this point where the platform's working, people are getting insights from the platform, and so just adding more folks on it and just really seeing the ability for us to change people's lives.
Yeah. Talk to me about the access piece. I'm just thinking about just whole communities, like we've discussed, whole communities. What's life like a few years from now when really that kind of care that we're talking about is just a tap away on the phone?
Yeah, to me, I think it's revolutionary and changing. If you look at where we're at today, we've got shortage of clinicians, and first time since I've been in healthcare like 30 years that we haven't matched in the resident or the medical students going to residency for emergency med and primary medicine.
Right.
And so the shortage is going to keep.
Side note, that's wild.
It is wild.
Yeah.
Like, it's really mind blowing, but it comes to the lifestyle that doctors have. The money's not there like it used to be. And now most of the docs I know that are in primary care spend at least 2 hours a day after they're done seeing patients, entering things in the EHR.
I was going to say, I don't think it's the money.
Yeah.
I don't think it's the money.
It's a horrible quality of life.
Yeah, it's what you just said. It's the time in front of the computer. It's the paperwork. Yeah. And so it's creating this this crunch that's putting folks who live in underserved communities at even greater risk.
It is. And healthcare is really being rationed again. And so, I mean, it used to be when I was a kid, if I got sick, I could call the doctor that morning and go get an appointment. That doesn't happen today. You're like a week out.
Yeah.
And to get a physical, you're like 6 months out.
Yeah.
And that's just everywhere in the country. So, we want to build tools that not only help the individual consumer, but the clinician as well.
What are the milestones you're hoping to hit in the next, say, 12 months in terms of patients, people you're working with?
Yeah, so we're looking to be a little more than 14,000 people on the platform and 100 direct primary care clinicians.
Nice.
Yeah.
That's awesome. Well, Chris, it's exciting to watch you grow. It seems like this is going to be an inflection year for you guys.
For sure.
As you get into people's hands, you start being able to measure the good that you're doing and real outcomes, and it's going to be exciting to watch. So thanks for all you do.
Yeah, can I throw one last shameless
Yeah,
plug
go
in
for
there? We're going to kick off our seed round.
Okay.
And so hoping to have it closed by June.
Okay. You're kicking it off now?
Kicking it off now.
Okay.
And so we've got 2 million committed. We're looking for another 4.
Okay.
So yeah, anybody that wants to learn, build more, or
What
join
are you
us.
primarily hoping to do with that raise, with those 4 million?
Yeah, so mostly marketing and sales, but a little bit of the technology. So we've got some large language model prototypes that we want to deploy. So we need a little more capital to deploy those, as well as really penetrate the DPC market and start adding some payers.
Nice, awesome.
Yeah.
Well, I wish you the best with that.
Cool.
And we'll be watching to see how you scale and grow that product.
Awesome. Thanks,
All right,
Logan.
thanks, Chris.
Yeah, appreciate it.